Thanks for being here. And now we'll move over to you, Dr. O'Connell.
Good morning. It's so nice to be here. So I'm Dr. Lauren O'Connell. I'm what's called a developmental behavioral pediatrician, which means I trained as a pediatrician and then have done additional training around how kids' brains work and how that affects how they learn and behave. I see patients mostly at Ipsy Health Center and some at Mott, and I see kids for all kinds of things, including ADHD, and I'm really excited to talk about that today.
Fantastic. Thank you so much. And we have one panelist left to round things out.
Hi, I'm Dana Gadir. I'm a psychologist and behavior analyst in the Department of Pediatrics. My primary role involves the integration of behavioral health supports in pediatric primary care and the evaluation of those outcomes. I work primarily at Briarwood Center for Women, Children, and Young Adults. And my background involves a variety of different training experiences in schools and academic institutions, also working in the areas of autism and ADHD. And I'm also the mother of four very fun and spicy kiddos who force me to practice what I preach with highly variable degrees of success. So
Fantastic. I love the description spicy. That's great. I could probably describe my own in a similar way. So, thank you all for being here. Fantastic to have you here. And before we start, just a few more housekeeping items to our viewers. If you're watching this live, you know you can submit questions at any time, and we'll pick some to be asked during today's chat. Questions can also be submitted by commenting on this video on whatever platform you're watching on. But please note that if you do so, your name or your profile name will be visible to others participating. If you prefer a more anonymous option, you can send a private message to us via the Facebook direct message function on our Michigan Medicine Facebook page. That's at facebook.com/Michigan Medicine. We know that there may be many questions, so we'll likely combine some of them if they're on the same topic. Please know that our experts can't give super specific advice for an individual situation that you might be facing. If you can't stay for the whole chat, if you want to share the recording with a friend, you'll be able to watch after the live stream ends via the Michigan Medicine YouTube channel. So really good stuff there. You know what? I just got word that we need to do a couple of intros one more time. It looks like we need Dr. O'Connell and Dr. Inja just to introduce themselves maybe one more time, if we could, for our audience.
Sure, I'll go first. I'm Dr. Lauren O'Connell. I'm a developmental behavioral pediatrician at Michigan Medicine. That means I trained as a pediatrician and then have done additional training around how kids' brains work and how that affects how they learn and behave. I see kids of all ages, 0 to 18, mostly at Ypsilanti Health Center with some clinics at Mott. And I see kids with a variety of diagnoses and challenges, including ADHD. I also have an interest in research around early relational health. Thanks so much for having me.
Thank you. And Dr. Inja, if you could perhaps introduce yourself
Yeah,
again. I think we had a
definitely. And
gremlin in the
yeah, it gives
system.
me a chance to do that much better this time. So, again, I'm Yavuz Ince. I'm a child psychiatrist at the University of Michigan. I primarily work at the outpatient side. I mainly see kids with ASD, ADHD, and other neurodevelopmental disorders, rare genetic conditions, or kind of interesting psychiatric conditions such as catatonia. I also co-lead with Dr. Riggs our ADHD clinic where we see patients with suspected ADHD and we make treatment recommendations. I also love teaching and I teach fellows and residents and medical students. So yeah, I'm happy to be
Thank
here.
you. Yeah, thank you so much. I think our other two guests, we were just fine, but we had a little gremlin that was causing issues with the sound for you two. So now we can move to our questions. And the first one I'm going to kick off with is what causes ADHD and how common is it? If we have any of our experts want to jump in first, that's always the trickiest thing.
Yeah, I can talk about kind of what ADHD is. I think the cause of ADHD is very much still being investigated. A lot of times, doctors and other professionals will say something like multifactorial, which just means that there's probably some genetic impact, meaning inherited impact or in the genetic code, and probably a lot of environmental impact as well, meaning what the type of environment you've grown up in. What we do know is what causes ADHD in the sense of what's happening in the brain. And I'm just going to give a little what I actually talk about with families when we diagnose ADHD, which is to say, think about there's a part of our brain called the prefrontal cortex. It's right here, and one of its many jobs is something called executive function, which should work like a gate. Here's my little visual aid for a gate. And in all kids, that gate's a little leaky. But what should be happening with that gate is that executive function is deciding very quickly, not on purpose, but is deciding what to let in. So, what do I pay attention to right now? What's important? What should I remember? It's also deciding what to let out. How do I respond? How strongly do I respond? Do I hit? Do I yell? All of those things. Now, in all kids, like I said, that gate's a little leaky, but in folks with ADHD, it's just blowing in the wind. So it's not that folks with ADHD can't pay attention. It's actually that they're paying attention to everything equally. It's all coming in at the same level, and it takes a lot of extra work, cognitive energy, and thought to sort out what matters. And similarly, it's not that folks with ADHD are necessarily deciding to be naughty. Bad habits can happen, but they're not deciding to be naughty. It's actually that things are happening before there's a chance to decide. So that's what causes ADHD. I'd love to hear of other folks about like how common it is and all that kind of stuff.
That was such a great metaphor. Thank you, Lauren.
Steve,
I'll just chime in a little bit. Generally speaking, the prevalence rates are pretty variable, and they depend on how we're assessing and different demographic groups. But generally speaking, around 8 to 12% of males currently, and about half of that in females. Although there's a lot of research, and my team here in PEDS is working on some of this work, looking at how are we missing kids, females, kids from marginalized backgrounds, kids with other conditions who may have ADHD and may not be getting recognized.
Thank you for that. I don't know if our other two panelists have anything else to add. Yeah, it looks like those were fantastic answers. The next question we have, how can I tell the difference between ADHD and other conditions? I see some nods from our panelists. I don't know who wants to kick off with that. Jessica?
Sure. I think the answer to that question is a little complicated depending on which other conditions we're thinking about. And so I think it's maybe helpful to start by acknowledging and talking about the fact that ADHD co-occurs with lots of other diagnoses. It can also be a standalone diagnosis. That's certainly true. But we see that kids with ADHD might also have other diagnoses. We've talked a lot about autism or other neurodevelopmental disorders a little bit in our introductions today. Those can have a higher comorbidity rate, or they can co-occur together at higher rates, as can other learning challenges or things related to those prefrontal cortex functions that Dr. O'Connell was talking about. But it can also co-occur with things like anxiety or depression. And with all of our mental health diagnoses, there's no symptom that's part of just one diagnosis. And so there may be things that get amplified or exacerbated when there are these other conditions that occur. So it's really challenging sometimes if someone presents for treatment or to their provider and says, I think that I have ADHD. All of us and our colleagues that we work with will do things like ask questions to understand, are there other things that might be contributing to those symptoms that make you think you might have ADHD? That might be a better explanation for what you're experiencing, or might be it might be ADHD and one of those other pieces as well. So our evaluation process for ADHD and most of the diagnoses we work with it's important for us to be really thorough, take a good history, get some like objective measurements and collect some data to make sure that we are understanding not just yes, no, do you have ADHD, but also yes, no, do you have other conditions that are present that might impact how we want to address or support you in managing ADHD. So it's a complicated process.
Yeah, it sounds like it, Dr. Riggs. I saw lots of nods from other people. I don't know if anyone has anything to add.
And just to piggyback on what my colleague mentioned, differentiation is important, but also there are some mimickers as well. For example, sometimes obstructive sleep apnea may manifest like ADHD during the daytime, or iron deficiency anemia, thyroid problems, substance use disorders. So it is also like when we think about ADHD, it's very comorbid, but also there are other medical conditions that may look like ADHD that we often investigate and then screen for.
I think
Dr.
all of these are really valuable points, and especially as a parent, sometimes it really is kind of a game of looking for chicken versus the egg. What came first, right? Were you anxious and then it's hard to pay attention, or do you have attention difficulties? You feel overwhelmed and that makes you anxious. And the reason it's important is because there really aren't any blood tests or clear-cut ways of assessing for ADHD. And I give the example to parents. My husband is a psychologist. I'm a psychologist, and we could see the same case, but with slightly different training. I might lean towards one diagnosis, he might lean towards another. So we try to be very uniform, but if you feel like you're not getting the diagnosis or it's not thorough enough, seek a second opinion, see what somebody else has to say, because we all have our different biases.
I completely agree with everything my colleagues have said. It's really lovely to hear everything, and I wanted to add one thing. I think that one thing that does can distinguish ADHD from some other conditions is that it really does affect everything. Because executive function challenges can underlie a lot of other things. And so it's pretty uncommon to have a kid with ADHD having challenges in only one area of their life. And if that's the case, I'm going to think much more carefully about other things leading to those challenges. Whereas a kid with ADHD, someone with executive function challenges, those challenges are going to impact all of their important jobs as a kid, whether that's getting along with friends, learning academically, learning in all the other ways you have to learn. And so it's most common to see those types of challenges, what we call it across settings. And so that's actually an important part of the evaluation that we all do is going to be getting information, not just from a home setting or not just from school, but from both.
I think that's why it makes it really a public health problem, right? So when we Google ADHD, look at the images. The image we see is a young boy sitting in a classroom. But as my colleague mentioned, it impacts everything. It impacts teen pregnancy. It impacts incarceration rate, high school graduation, salary. It impacts everything in one's life, their mortality, their risk of suicidality. So I think we should really look at all the components of one's life when we are investigating for ADHD, and also as well as the family history. Yeah.
Yeah, thank you so much. Such a many-layered thing here. This is something that we touched on. Dr. Riggs, I think you touched on this too, but our next question, if there's anything else we can add, which other conditions do people with ADHD often experience?
Yeah, based on like MT study, the most and this study was done in 1990s, and at the time they excluded patients with ASD, with autism spectrum disorders, and you cannot really diagnose autism up until 2013 by DSM-5 criteria. I'm sorry, you weren't able to diagnose ADHD in patient autism up until 2013. So DSM-5 criteria, DSM-5 really made it possible for us to diagnose ADHD in kids with ASD. So in MT study, they excluded patients with ASD. But if you look at non-ASD population, the most common conditions were anxiety disorders, oppositional defiant disorder, and learning disorders. These were three most common conditions that we saw in patients with ADHD.
Thank you. I don't know if anyone has anything to add, or we can move on to our next question. Looks like we can jump over to our next question, which is what is the relationship between ADHD and substance use?
I know some of my colleagues, this is like a very specific area of expertise for them, and I'm looking forward to hearing that. I do want to comment as someone who sees a lot of young kids with ADHD, where sometimes this question is coming from a concern about how do we treat this condition in a way that's going to minimize substance use in the future. So just to touch briefly on that, I think that the strongest evidence shows that untreated ADHD is associated with substance use disorder in the future. And so from my perspective, it's all about like, let's get these kids the resources and supports they need to treat these conditions. And that sometimes does include medication. And the great thing about the medications that we use for ADHD is that they are not habit forming. They don't lead to tolerance or things like related to addiction per se. So it's really, yeah, that's what I wanted to jump in to say about early treatment of ADHD. But I know there's more nuanced stuff to say as well.
I think when we go back to executive functioning, one part of executive functioning is controlling impulsivity or pleasure seeking. So when I feel upset, I eat ice cream from time to time. Or I go for a run, I go for a walk. So this is kind of how I try to kind of calm my nervous system. And a lot of people engage in different things to calm their nervous system. And immediate rewards can be extremely appealing for someone who feels extremely overwhelmed at the time. And substances can provide that. So having that disability mindset in ADHD that they may have difficulty with delaying gratification or delaying something that gives instant pleasure, and having that mindset can help us in terms of informing us for treatments. As my colleague mentioned, usually for mild SUD, mild substance disorders, I try to treat ADHD as much as possible to decrease the need for impulsive decision making. However, when it's more moderate and severe, it becomes a bit more nuanced. But we do know that treating ADHD may decrease risk of SUD in this patient population. So it's an important thing to address.
Dana, I saw you unmute a while ago. I don't know if you have anything to add.
I was going to say much of the same that my colleague just said. I think, long story short, the studies suggesting that stimulant medication increase the risk of substance abuse, and these studies did occur, and those were the findings, but they kind of ignored what we know now, which is that it's not the stimulant use, it's the ADHD, right? That makes kids more impulsive and more likely to abuse drugs. So compared to healthy controls, yes, kids with ADHD who take stimulants are at increased risk of substance abuse. But compared to young kids with ADHD who don't take stimulants, they're actually at decreased risk. So it's the treatment that matters.
Thank you for that. The next question, and again, I feel like this is one that we've touched on, but there are so many different nuances to this. How can you tell the difference between ADHD and intellectual disability or autism, and can they exist together?
I think we can start by saying they absolutely can and do exist together. And I think one maybe common worry from families is that if my child receives an ADHD diagnosis, does that mean they're at risk for autism or intellectual disability? And that's not what we see with those statistics. So individuals with intellectual disability and or autism have higher rates of ADHD compared to people without those diagnoses. But among people with ADHD, there isn't the increased risk then of having autism or a cognitive impairment compared to individuals without ADHD. So that like increase of co-occurrence only really happens in one direction. But they can and they do co-occur. And one of the ways that we work really hard to tell the difference is through that comprehensive assessment. So with intellectual disability, we'll see that it's not just those executive functioning skills that are impaired. We'll see a more global impairment. So that would include things like verbal reasoning, visual spatial processing, fluid reasoning, and other cognitive functions. With an individual with ADHD, we might actually see that they have strengths in those areas and may have above average intellectual abilities and maybe have those like relative weaknesses in things like working memory and processing speed and planning things out in multiple steps. With autism, that's a diagnosis that has some overlap in symptoms with ADHD, but primarily is centered around difficulties with social communication and an increase in things like restricted interests or repetitive behaviors or sensory processing behaviors. And so our evaluations are always looking to kind of look at the patterns across all these different areas. To help us know what's the best diagnosis or combination of diagnoses that fit an individual.
And also, like from treatment perspective, that can also like addressing ADHD can also improve gains in treatment for other conditions. Like for example, for ASD, sometimes physicians recommend speech therapy, physical therapy, applied behavior analysis. And I often hear from my parents who have kids with ASD plus ADHD. Once we try to treat ADHD, they see more rapid, more robust improvement in terms of their engagement and skill learning. So addressing ADHD can also improve that aspect. My colleague mentioned about executive functioning, and emotion regulation is also a big part of executive functioning too, regulating big feelings. And people with ADHD are more likely to have behavioral outbursts, emotional outbursts, and things like that. So if somebody already has difficulty regulating big emotions due to their other condition, addressing ADHD may make it a little bit less likely, can improve threshold, can give them a little more breathing room before acting. So from a treatment perspective, it can be also quite helpful to address ADHD in these comorbid conditions.
And as a parent, I think sometimes we really want to know what's causing what. And I would just say that sometimes we don't know exactly what, if you, especially if you have multiple diagnoses, what's causing this particular behavior. We may not know exactly. We may have to make a good guess or a hypothesis and try something and see if it helps. And as long as we're doing that in a careful and well thought out way, that's okay. Because if we try something and it didn't work, well, then we can now try something else. So I think it's okay to not always know exactly what's driving a specific behavior, as long as the whole care team is open about that and has a kind of organized approach to what to try. Thanks.
I agree. I think we're increasingly understanding that there is so much genetic covariability with these conditions, autism and ADHD specifically. And the field is looking at all these things and trying to figure out like what makes one lean more towards the ADHD side versus the autism side. And, to take a gross analogy, it's much like picking your nose. Like I ask kids, you picking your nose, what are you going to do with it, right? What is the purpose of this diagnosis? Is it to get stimulant medications so that we can try that and see if that kind of brings it down a notch so that you can focus? Is it to get ABA interventions so that you can get some of these social skills or, prerequisite skills for school? So it really becomes a functional issue of, what are the deficits that this kid is experiencing given the expectations in their current environments?
Thank you all for those answers. We have hit the halfway mark, and a couple of housekeeping items. Those in the audience who registered for the event beforehand, you will receive the YouTube link afterwards via email. I know that we are also having a few issues with closed captioning on YouTube. That's going to be available after the fact too, after the live stream has ended. I'm sorry for those difficulties. If you're watching this live, you can submit questions at any time and we'll pick some to be asked during today's chat. But please know your name or profile name will be visible to others participating. So you can always send us a private message on Facebook at facebook.com/Michigan Medicine. That's our page. So those are our two main housekeeping items. Let's jump back in with our question. And the next question we have up, do you have a higher likelihood of having ADHD if you have relatives with it?
I mean, the short answer is yes. The short answer is that there is a genetic component to a lot of ADHD diagnoses. And sometimes I'll say, like, every family has a flavor. Like, it tends to run in families, but it doesn't only run in families. And that's not the only thing that leads you to have ADHD. So, it is again that word multifactorial. But the short answer is yes, it does tend to run in families.
And I know that we weren't supposed we were kind of debating between should we discuss about adult ADHD or not, but this is one of my biggest counterpoints to that argument that you cannot diagnose ADHD in adults. Because if you have ADHD, you're like more likelihood that one of your parents had it. There's this statistically higher risk. So managing ADHD kid as an ADHD parent is extremely difficult. And I really want to emphasize this because, for example, stimulant medications, we can only prescribe for 30 days. So every 30 days, you have to double check if your child is still have medication. You have to contact doctor's office, ask for a refill. You have to take them to the appointment, put their appointment time to your calendar, follow up on that, go to these appointments, discuss with the doctor. I'm a physician. I have significant difficulty when I talk with my veterinarian. I have so much difficulty sitting there understanding all that emotion in that short amount of time. I cannot imagine doing that for medicine as an ADHD parent. So that's what I really want to emphasize, not only from a diagnostic perspective, but from treatment perspective. If you feel that the patient's parent is also having difficulty, you really have to be mindful about your treatment plan, and you have to incorporate that to your treatment plan. Maybe writing things down or sending them reminders or asking them to set up the alarm while they're in your office can be good strategies.
I second all of that. And it really comes down to the impairment that kids face that we work with a lot in primary care, where we know that higher levels of parental symptoms, usually we're talking about mothers because few studies really target the roles of fathers, but, the more forgetful, the more difficulty mom has and dad, following through with these recommendations, setting up routines, maintaining calm in stressful family interactions with mild to severe conflict. All of these predict more severe symptoms in kids. So it really becomes a matter of treating the entire family and creating structure and systems and figuring out how to help this family work together.
Thank you for that. The next question we have up, it's a double question. Are medications the only way to treat ADHD? And if not, are they the best way?
So
Oh, go ahead.
no,
I'll
please,
let the
Dan.
doctor
Please go.
answer first.
No, please go ahead.
I was just going to say they are a great way of treating them, and I will let Dr. Inja talk about that. Some of the studies do show that the best way, at least my bias, the best way, and what the research that I've used is a combination of medication plus behavioral interventions, and a lot of that research shows often the medication is very much necessary, but sometimes we can do a lower dose and we can build some skills that maybe you don't get from the medication. And so they can work in tandem to really maximize the benefits of behavioral interventions plus medication. But I'll let Dr. Inja talk more about the medication aspect.
Yeah, I mean, medications are quite effective, and ADHD is one of the best things that I love treating because you see a robust response to treatment. A lot of things that inform our decision making comes from MTA study, and it showed that robust therapy plus medication versus medication alone did not show significant difference in terms of controlling ADHD symptoms. That was in 1990s. In that study, they had very robust therapy support, school support, therapists, parental management. It was extremely robust. And despite that, medication alone was as effective for controlling ADHD symptoms. I think we are now living in an age which will be very ADHD friendly. Like we have this Zoom meeting, I have my notes in front of me. It gets transcribed. I can watch this video again in the future. So I have so much optimism and hope for the future of ADHD management. Medications are not the only way. One of the analogies that I give my families is that we really have to find ways to hack this condition. So you know yourself the best. Let's find and trick this ADHD. So families tell me my child is able to sit and play video games for 6 hours, but they cannot do their math homework. I'm like, yes, because of ADHD. So gamifying their environment is important. Immediate rewards. Maybe like whenever you pass a level in a video game, there's like a different screen, new environment. You get immediate rewards. You get immediate punishments if you make a mistake in the game. There's lights and sounds that gives you a lot of positive feedback. So how can make one's environment much more game-like is an excellent place to start in terms of behavioral management and how we can change the environment to support the individual.
I just wanted to, I agree with all of that. I think for some kids that gamifying is such a great idea, if that's something they're drawn to. I had used that metaphor of the gate before, and I think that thinking about the gate is really helpful. So if we're saying that this gate is not working well and is letting things in and out that it shouldn't, the way that we treat that then is in two ways. One is that we add other gates, sometimes literal gates, like you cannot go in this space, but we add other gates, right? And that's what the therapy works on with families and kids to build skills, to build strategies, to build approaches. And then we also tighten up the gate itself. And that's what the medication does by targeting different pathways in the brain and different neurochemicals in the brain to help that executive function work better.
Thank you so much for answering these super tricky questions with so many different elements to them. The next one we have up, also medication related. What are the most effective medications for treating ADHD?
So in psychiatry, we use effect size usually. Effect size is basically how medication is effective compared to placebo. And in psychiatry, most of the antidepressants or anti-anxiety medications we use for depression or anxiety is between zero point 0.3 to zero point 0.5 effect size. For stimulants for ADHD, it is between 0.8 to 1.2. So they're extremely effective. The second line usually is atomoxetine. It's a medication that is not non-stimulant, and its effect size is between 0.6 to 0.8. And then we have other non-stimulant options such as guanfacine, clonidine. There's some research on duloxetine, bupropion. So these are the most common medications we use. In younger kids, we try to choose methylphenidate class of medications, and in young adults, we try to use dextroamphetamine, Adderall type of medications. And especially younger kids, we try to start low dose and increase very gradually.
Thank you. I don't know if anyone else has anything to add.
I concur.
The next question we have up, what kind of side effects do common ADHD medications have?
I can take that on stimulants at least. For psychostimulants, which are the most effective medications against treating ADHD, we know a lot about stimulants. Methylphenidate's been around since the 1950s, so we honestly have as much or more information about this chemical, this medication, as any other. All of which is to say they're really safe on the population level. There are some common side effects, like any medication. You can have headache or stomach ache when starting something new, and as your body gets used to it. Psychostimulants, in addition to sort of stimulating the brain, can also rev up the cardiac system. And so you can see increases in heart rate or increases in blood pressure, and your physician will or other care provider is going to be thinking about that carefully and doing any monitoring around that they need to. What that means practically is that a kid may feel like funny. It shouldn't hurt in any way. And then the other two big ones we'll talk about is stimulant medications have not been found in careful studies to cause tics or repetitive behaviors, but in someone who's already having them, they can make them more noticeable, more bothersome to others. And so sometimes you will have sort of an unmasking of those tics, as what is the phrase we often use. And then the big one that we talk about a lot is decreased appetite. It is pretty common to have a decreased appetite on a psychostimulant. It's not 100%, but it's pretty common. That can be okay if you're eating when you're not on the stimulant. There's lots of ways to get around that, but we will monitor weight closely to make sure that that's not negatively impacting a kid.
A very interesting phenomenon for kids with ADHD without medication is that they have difficulty understanding physical needs. It's so fascinating phenomenon to me, and I hear that from families. Like I ask them if they feel cold, and I touch their feet. Their hand is super cold. They tell me that they don't feel cold. Or I ask them if they're hungry. They say no. I bring some food, and they eat. They finish everything they even try to get from my own plate. So that's a very common phenomenon that we see with kids with ADHD. They have difficulty really on paying attention to their internal cues. So difficulty with attention with bodily needs. So really, when we start medication, we really have to be mindful about that. They already have this vulnerability. So one recommendation that I have for families is that we really have to function as their external brain and schedule meals as much as possible, making sure that they eat very good breakfast before medication, and maybe schedule as much snack as possible throughout the day. And I don't know if you, but when I feel hungry, I'm also a little bit difficult with I have difficult with attention, emotion control. So we really have to do everything in our capacity to minimize those needs by being mindful about them, by scheduling meals and making sure that they feel warm, that they don't feel cold, and their bodily needs are met.
Thank you so much. I don't know if either of our other experts want to add anything, or we can move on to our next question. Looks like
Happy to not talk about medications as I'm not prescriber. So
the next question we have up, how can psychotherapy help treat ADHD?
I'm happy to maybe jump in there as someone
Excellent. Thanks, Dr.
who
Riggs.
does psychotherapy in my scope of practice. Since I'm not a prescriber, I can't prescribe medications. So psychotherapy can be incredibly helpful for individuals with ADHD. The most effective interventions to support ADHD are behavioral management type supports. And for most individuals, this is going to be like a parent management training or a therapy that's really meeting with parents or caregivers and helping them interact with their children in a way that gets them sort of the results that they're looking for. And this can be, I think, a space where us providers have to be really clear with parents when we're explaining the interventions, because most of the time, if you bring your child to a provider and you say they need help with A, B, and C, the response isn't, okay, you parent have to meet with me weekly for psychotherapy visits now. That might not be what the parent is expecting, but we see it's what ends up being most effective from a psychotherapy perspective. And so really what those sessions look like are helping parents attend to and read their child's cues and what they need, when they need more support, when they need breaks, to provide lots of positive reinforcement or rewards for small incremental improvements of things going more in the direction that we want it to go. And really working on, we call them antecedents. It's sort of the things that happen before the distracted, disruptive, or problem behavior, and attending to those and addressing them before the behavior becomes disruptive. This is a really hard thing to do. As like a person who's trained and has a PhD in behavioral interventions, this is hard for me to do. It's really hard for parents to do as well. And so we want in those psychotherapy sessions to provide parents a ton of support. As my colleagues have said, there is a genetic or inherited component for ADHD. So oftentimes asking parents to attend to all those things and supporting their kids can be a really big challenge. And so we want to sort of think about the mark of success being slow and steady, and stopping and keep reassessing and see what's needed, what is appropriate to ask of this family at this time, what other supports does this parent or caregiver need in order to implement this intervention, because we really don't want to think about like families like failing in this psychotherapy approach. It would always be the case that the treatment wasn't set up successfully for the family to be successful, and as providers we can slow down and help with that, and maybe tighten up our own gate a little bit with what we're expecting from families.
Thank you so much for that. Dana?
I would agree with everything my colleague just said. I think a lot of what we do is consult with the systems and caregivers to facilitate these opportunities for success. Kids, by the time they're in 6th grade, kids with ADHD get about 20,000 more critical statements than their non-diagnosed peers. So are they defensive and sensitive to criticism from the get-go, or do we create that? I don't totally know the answer to that. But I personally like to build opportunities for success. So not saying you get this accommodation so you don't have to spell things correctly or turn your work in, but how do we support you so that you can do it and feel good about it, and get that reinforcement. With older kids, we also can do some cognitive behavioral work to kind of restructure some of those negative automatic thoughts, create coping skills, empowering kids to increase their confidence and engage in social skills that may come a little bit more difficult to them. And then just providing some really breaking things down so that they can reduce their daily stress and not feel quite so overwhelmed, building in routines and external cues and modifiers to help them get through the day.
I also want to stress that the earlier study that I mentioned, combined therapy plus medication group needed less medication to control ADHD symptoms compared to a medication group alone. So, and I see that in my clinical practice all the time. Good psychotherapy can really make it less likely that we will use high dose medication. So it's extremely important.
Likewise, I think the medication allows kids to pick up on the external cues and the daily report cards and the other behavioral supports we're putting in. So they really work hand in hand.
Thank you for that. The next question we have up reads, what kinds of changes to daily life and lifestyles can people with ADHD make to improve their well-being?
So a big one I'll always talk about is sleep. All of our brains function at our most optimal level when we're getting enough sleep. And that doesn't just mean the right number of hours of sleep, but also high quality sleep, making sure it's not impacted by breathing disturbances or things like night terrors or like nightmare disorders or things like that. So addressing and treating anything that's getting in the way of sleep can also be really important and helpful because that's just heightened with individuals with ADHD.
I saw a patient this week. His parents incorporated gym lessons early in the day, so they work with the school. So mom was telling me that it really helps his weeklies, and he's more likely to stay at school and engage second, third, and fourth lecture due to the fact that he's able to really move his body. I have some families ask their children to make laps around the house before they come into the house after school. So physical activity is extremely important, and body loves routine. Kids love the routine. So any way we can optimize routine as much as possible would be important.
Absolutely. I'm thinking of the AI revolution in this and, how can we automate? How can we build routines so that it requires less of our, cognitive, effortful control? And that is 100% true for kids and adults with ADHD. The more you can, allow things to succeed on autopilot, the better. That's true for all of us. I think also one thing that I work with caregivers on is how to teach those self-monitoring skills. So that's a key deficit where kids sometimes don't realize when they're meeting expectations and vice versa. So, one key tenet is ask, don't tell, right? So ask the kid, how do you think you did there, right? I may know what I think, and I'll tell them. But I want to ask first and kind of get some feedback. Also, when something does go well, how in the world did you do that, right? How did you remember to do this correctly, right? Even if it was something small, to just really get them reflecting on some of those practices.
Thank you for that. The next question up, what are some common features of ADHD that people may not immediately associate with the condition if they're not familiar with it?
I have so much feelings about that, but I will let Dr. Riggs answer first.
So I think some people do consider this a sign of ADHD. So I'm not sure, but I think for many families it doesn't feel like one, and that might be like emotional lability or explosiveness, or I think sometimes parents will talk about like their child or their teen like talking back or using like an inappropriate tone, and some of that is not diagnostic, right? That's just part of the normative developmental process that kids sometimes use those strategies, and that's okay. Um, One thing that I think is important to think about for someone who's having a hard time attending to their environment, you may have asked them to do something 5 or 6 times and it hasn't registered or landed with them because they're taking in so many other pieces of the environment. And so when you understandably get to that space where you're maybe raising your voice or using harsh words or having like an upset look on your face, and you finally break through with that like escalated way of getting their attention, you might get a response of like, those are what, geez, oh my gosh, calm down. And then it might sort of set everyone off into this cycle of arguing with one another. And it can feel like I think parents or caregivers will say like, they know that's going to get them in trouble. Why are they choosing to do it? And when I just really provide some information that it's not necessarily a choice, they may be acting without thinking before they're doing it. And also their experience may be that they weren't aware that they missed your cue to engage or your instruction or your direction multiple times. It might feel like the first time you asked them to do something, you were being pretty harsh and frustrated. And so, like Dr. Kader was mentioning, the self-monitoring skills for someone with ADHD. When you're interacting with someone with ADHD, you can also maybe try to use that perspective taking of like, what is this person experiencing when I'm talking to them? And what are their cues that I have their attention before I start interacting with them?
Exactly. The socialization, I think a big piece. And unfortunately, the scales that we use in clinical practice, one of the most common was Vanderbilt scale. It doesn't actually assess for socialization. There's only one question about the relationship with the peers. It doesn't really dig deeper about the socialization. And I think socialization piece is a very significant impact of ADHD, but I think it's a little bit ignored and in field of medicine, we mainly focus on hyperactivity, impulsivity, academic functioning, vocational functioning, but socialization is a big piece of one's self-esteem, one's sense of success. When you have ADHD, you have difficulty following a conversation with your friend. You have difficulty maybe being consistent by being a friend. You may have difficulty with emotional regulation, as my colleague mentioned. So that's I often ask about that, and there are a lot of stories that over time I accumulated in my data set that how ADHD may impact one's social life and their self-esteem and their sense of success.
I just want to really echo both of those kind of areas of function, the emotional regulation and the social piece. Kids and young adults with ADHD may not realize they've been monopolizing the conversation, for example, or they may not realize that they haven't responded because they're like distracted by something else the whole time. And I think that attention piece is often miss. We're best both like in the home, at school, and in the doctor's office. We're best at noticing those what we call externalizing behaviors, the behaviors that are hyperactive, the behaviors that are impulsive, and we're less good sometimes at recognizing those inattentive behaviors writ large. And so I think those are the things sometimes folks aren't thinking about.
I would just add, I think the social conflict sometimes drama or kids who are described, I think the word is extra now, they're just a little extra, is often a common symptom. Time management, overwhelm and anxiety. And then I think a lot of parents get confused because, like my colleague did say earlier, sometimes kids really can hyper focus and they can pay great attention on certain things. And it actually makes them very sensitive to screens and, getting sucked into certain things. So it can be really difficult to kind of notice when a kid has trouble with that gate system that Lauren is talking about, when they can really focus and they can do a lot of things, just not always. So sometimes it's not coming through when they most need it. But hyperfocus is definitely another symptom of it that can also be a superpower. So.
Thank you, all of you for the answer there. We'll have one eye on the clock, so this might be our last question, but it's a biggie. What are your top tips for parents of children with ADHD in regard to helping shift their child's perspective of a particular routine or task from something that's overwhelming or perhaps has negative connotations or associations to something that is reassuring and positive and can become a consistent practice over time?
I can maybe start with that. We want to be really thoughtful in starting small with a shift like that. And so if your child with ADHD finds something really aversive or the way they've tackled it before has led to more negative feedback from others that they're not doing it the right way or they're not doing it good enough, just giving them that whole task to do and asking them to feel more positive about it might feel really insurmountable. And so a strategy that we can use is break it down into smaller pieces, which then gives us lots of opportunity for feedback and coaching along the way instead of this five-step project you have to do. Like if you take like getting ready for school, for example, we could say that's one task, or we could break it down into 15 different tasks that you have to do in the morning: brush your teeth, get dressed, pack your lunch, all those pieces. When we break even those things into smaller pieces, we can do more monitoring, give more immediate feedback. Great job. You were right on top of that today. Do you know what's next? Do you need a reminder? And help them kind of stay on track and give them all that reinforcement as they're going. And then also increase the chances that they'll be more successful. We can also then start smaller and add things once they've shown like mastery of one piece. So maybe you do this component of the getting ready, checklist on your own. And then once you show that you can get that done 4 out of 5 days of the week before school, we're going to add one extra step to it, and I'll provide some scaffolding and support there. But we want to make it manageable. We want to make sure their chance of success is really, really high, and give lots of reinforcement.
Thanks so much. I don't know if any of our other experts have anything to add.
I would just add, there's one thing that I hear a lot from parents, and that is some concern about using those reinforcers, bribing their kids, if they will, to do tasks that seem kind of mundane and just expected. And what I always tell them is, it's not bribing. We're not trying to get them to do anything illegal, inappropriate. We're trying to help them, right? But we all require reinforcement to keep us doing the things that we may not always want to do, even on our best days. And the key is to get in there, give lots of positive feedback, reinforcement, whether that's praise, specific praise for what they're doing, tangible items, activities, really focusing in on what you want to see more of, and then fading that out over time. Because no, you don't have to be giving your kids Skittles for paying attention or getting their towels off the floor when they're 25. We're going to fade it out, right? And that's the part that people often forget.
Yeah, I would just echo, I think the top tip would be make it smaller and have empathy. I think that it's not really like a hack, I guess, but having empathy and building your parental empathy, I think is really important. And so being on a live stream like this, understanding what's going on is a really important step. And kind of just keeping in mind that kids aren't doing a certain behavior to give you a hard time. It's because they're having a hard time like that. And so that flipping that a little bit can help you join the problem solving.
And finding all of those, ADHD is awesome. There's so many ways in which ADHD is just a remarkable condition where kids can do creative things. They're so passionate. They live life to the fullest. I adore my patients with ADHD because they're just fun and spontaneous. And so, really locking into those strengths and the ways that this kid is just amazing.
Well, thank you so much for that response. We are headed towards the end of our time here. We have a ton more questions. So our viewers, we will, be sending these to our experts via email, endeavoring to get more answers, possibly maybe thinking about a part 2 to this, because an hour clearly isn't enough time because there are so many questions. So thank you to all our viewers for joining us today. Be sure to check any useful links posted to our comments section, any responses we get after the fact we could put in there too. And before we finish, I just wanted to open it up to our experts to see if you guys had any final thoughts or remarks, if you think there's anything we've missed.
I'll just say thank you. And just to echo what Dr. Gader said, that it really is, it's so fun working with folks with ADHD. And yes, we've echoed all the challenges, but it really can have so many superpowers. So I want to end on that positive. Thank you so much for your time.
Yeah, that was a lovely end thought there, Dr. Gadir. I don't know if anyone else has anything else to add.
I also want to mention that ADHD is just one part of one's personality and existence. There are a lot of other things that um, are important to us as human beings. That's a disability that may impact you, but at the same time, there are a lot of things that is available. So I have this optimism about the future, and hopefully with the AI, we can really delegate those kind of boring tasks to the machine so that we can continue enjoying life. But yeah, again, thanks for having us and thanks for participating this webinar. I personally learned, so I hope you did as well.
Fantastic stuff. So yeah, thanks to our 4 experts. Thank you to our viewers. Thank you for all the questions coming in. Thank you for watching. Have a good afternoon. And please do share the link to this video with others if you think that it would be helpful to them as well. Have a good afternoon.